My name's Dr. Manrina Rhode, and I want to talk to you about the use of AI in dental practice. It's a really exciting time that we're in at the moment, with so many developments moving at such a fast rate and wanting to embrace them, but wanting them to also work for us in a way that's useful and correct. At DRMR, we're all about technology and about embracing it where we think it's correct to do so. We've used AI with our x-rays for a long time now, where we have an AI program that reads our x-rays, it reads them at a pixel level, and then it reports on them. And so we read our x-rays always by human eye first of all to have a look, and then we put them through the AI. Patients really enjoy that. It's very good at picking up interproximal caries, and so it really reiterates that point about the importance of flossing. And then also there's a variety of treatment options available now for treating those early enamel lesions, so that we can help patients before they end up needing to have restorations. And pick these things up early. So that's a really useful aid. We also like to use chairside software with the visual aids that it creates for our patients, which maybe isn't AI, but it's digital, and now we're moving to have a look at the various AI technologies that are available for note writing, and there's so many out there at the moment, making sure that we can find a way that it's effective and it's correct. We had some issues with note writing software where we didn't feel like it was transcribing correctly, and so we felt like it was safer to just continue writing our notes by hand, but things are evolving, and we're trialing a whole variety of those, and as we trial them, I share with my mentees in my mentorship program the programs that we're using and the pros and cons of what we're having, because we're always pushing forward and trying to find the very best solutions. Obviously, we're moving from we've got our traditional veneers are the treatment that I by far do myself more than anything else in practice, but we have a team here where we offer a whole variety of treatments, and everyone that comes to see me gets a full face consultation to see cosmetically and on a health perspective what could be done to help and improve them. And we've always been very traditional in our veneer workflow, but we're also moving to a digital workflow now, using AI software that's available for smile design and to help with that process. We're using it more and more with Invisalign, these very quick Invisalign ClinChecks that are coming back, and then we do live updates and go in and change them and modify them. And again, it's something that we talk about in our mentorship program, about how to do that so that you're not relying on the ClinCheck that comes back, so that you're optimizing and improving. And then also the digital workflow that we've started to use with our veneer protocols, and we've been talking about that a great deal. And then more recently on the non-clinical side, we're introducing an AI receptionist as part of our team, which is an exciting collaboration that we're doing, so that we have an AI receptionist that can be booking appointments, doing follow-ups with new leads, calling a new lead as soon as it comes in, doing a follow-up at whatever time is suitable for that person to talk, be it 2 a.m. or whenever they want to, following up regarding Google reviews, and also with that whole lead workflow software, making sure that we're optimizing that to make sure that our leads are being spoken to while they're hot and while they're excited about these treatments that we offer, these exciting cosmetic treatments that we offer. So we'll have our first AI team member joining us next week. And then also the treatment plan workflow has always been a thing, right? With our treatment coordinators, who we now call client coordinators, writing up these treatment plans for our patients in a clear way, using English that they understand, not using jargon, and that used to take hours. We had to take our client coordinators, off into a room so they could spend a few hours making sure that they're writing up this document for our patients. And now it's so much quicker using AI, the AI software that we have, to pop that in. And I've gone through that process with my mentorship program, and I've got open mic session with them tomorrow that we're talking about how then to take to take your treatment plan on Dentally, which is what we use, and then how to pop it into AI to get it written in a way that's patient friendly within seconds, and then we use another software to then create a branded PDF. So we have this beautiful PDF, and then we can just slot the iTero scan, the photos, anything that we want to X-rays that we want to pop into this PDF software, so that it's so we've got this beautiful presentation for people who are looking at high value treatments and want beautiful solutions. They've also got this clear presentation that represents our brand and what we're doing, and all of that within minutes. So many introductions, so much movement going on, and I feel privileged that within my mentorship program that I get to share these exciting things that we're doing, the pros and cons of the different software that we're using, what we're using, exactly how we're using it, so that my mentees can also bring that into practice. Because sharing is caring, and it's fun learning these things, and it's even more fun sharing them and then other people using them and then reporting back on how that's working for them, as well as the different smile design protocols that we have for helping our patients and imaging for them to show them the result and how that's evolving, and sharing that. So lots of things going on that, if you're interested in, then please contact us and come and join my mentorship program and come through this journey with us in this exciting time in which dentistry is evolving.